Post-mortem skin integrity, a nurse's critical observation. The fluorescent lights of St. Jude's Hospital morgue hummed with a quiet, persistent drone. Sarah, a seasoned nurse with a compassionate heart and hands that moved with practiced precision, stood over the stainless steel table. The air was always cool here, a stark contrast to the bustling, warm wards upstairs. This was where life ended, and a different kind of care began. For Sarah, post-mortem care wasn't just a duty, it was a final act of dignity for the deceased. She believed every person, even in death, deserved respect and meticulous attention. She prepared bodies for their journey to the funeral home, ensuring they were clean, dressed, and presented with peace. Today, her patient was Mrs. Eleanor Vance, an 82-year-old woman admitted a few days ago with what appeared to be pneumonia. Her death, everyone agreed, was due to natural causes, a gentle fading in her sleep. Sarah began her work. She spoke softly, as she always did, murmuring words of comfort as if Mrs. Vance could still hear them. She carefully removed the hospital gown, her eyes scanning the frail body as she went. This was part of her routine, checking for any last medical devices, ensuring cleanliness, and noting any skin breakdown or abnormalities. Usually, with elderly patients, she'd find common pressure areas, perhaps some fragile skin tears. But what she saw on Mrs. Vance was different. As Sarah gently rolled Mrs. Vance onto her side to clean her back, her gaze caught on something unusual. Faint, reddish lines marred the delicate skin just above the hip, extending slightly towards the lower back. They weren't typical bedsores. These were thin, linear, almost like scratches. Not deep, but definitely there, a series of parallel marks. Sarah leaned closer, her brow furrowing. She ran a gloved finger lightly over one of the lines. It felt slightly raised, a subtle ridge against the cool skin. She mumbled to herself. She paused her cleaning, her mind ticking through possibilities. Had Mrs. Vance scratched herself? But the pattern seemed too uniform, too deliberate for a random itch. Could it have been from a piece of clothing, or perhaps a rough sheet? Sarah shook her head. The marks were too distinct, not a mere impression. They looked like what they were, scratches. A small tremor of unease ran through her. Mrs. Vance had been admitted from a nursing home. Her medical chart indicated no recent falls or incidents of agitation. Her family had been visiting regularly, seemingly attentive. The cause of death was listed as respiratory failure, common in the elderly. These scratches didn't fit. Sarah retrieved a small magnifying glass she kept in her kit. Under its magnification, the lines became clearer. They were indeed scratches, and they looked relatively fresh, certainly not old scars. They weren't deep enough to bleed, but they were definitely a break in the skin's integrity. And then she noticed something else, even fainter, on Mrs. Vance's inner forearm. Another set of similar, almost identical marks. This was getting stranger. Who scratches themselves on their inner forearm and lower back in such a way? Her colleagues often teased her about her eagle eyes, but it was more than just sharp vision. It was a refusal to let anything go unnoticed, a deep-seated belief that every detail mattered. She considered letting it go. "It's probably nothing, Sarah," she could almost hear her inner voice say. Just another little unexplained mark on an old body. But the feeling in her gut churned. It wasn't nothing. Not if it didn't have an obvious explanation. She finished the rest of Mrs. Vance's care, her mind preoccupied with the marks. Before covering the body, she took out her phone and, using sterile gloves, carefully photographed the scratches from a few angles, making sure to include a ruler for scale. This wasn't standard procedure for routine post-mortem care, but Sarah knew that documentation was key if she decided to raise a flag. Later that afternoon, after her shift, Sarah sought out Dr. Evans, the attending physician who had signed Mrs. Vance's death certificate. Dr. Evans was a busy man, often hurried, but he respected Sarah. "Dr. Evans," Sarah began, her voice calm but firm. "I was doing post-mortem care for Mrs. Vance today, and I noticed something I thought you should be aware of." Dr. Evans looked up from his notes, raising an eyebrow. "Yes, Sarah. Everything all right?" "Yes, mostly. But she had some unusual scratch marks on her lower back and inner forearm. They didn't seem consistent with anything in her chart, and they looked relatively recent. Dr. Evans sighed softly. Sarah, you know how fragile elderly skin can be. She was probably scratching an itch, or maybe caught herself on something in her sleep. Happens all the time. I understand that, Doctor, Sarah replied, holding his gaze. But these were quite distinct. Not just superficial. And the pattern was unusual. She hesitated, then pulled out her phone. I took some photos, if you'd care to see. He took the phone, his expression still skeptical, but curiosity flickering in his eyes as he looked at the images. He zoomed in, his lips pursing. You're right, they do look a bit odd. But still, she was declining. Her system was shutting down. Perhaps, Sarah said, but isn't it worth a second look? Just to be sure. Dr. Evans rubbed his chin. A full autopsy isn't warranted for a natural causes death, Sarah. It's a strain on resources. I'm not suggesting a full autopsy, Doctor, Sarah clarified. But perhaps a closer look from pathology. Just a superficial examination of those areas. He looked at her, sensing her conviction. Sarah wasn't one to make a fuss over nothing. All right, Sarah, he conceded. I'll make a note for Dr. Lee in pathology to take a quick look at those areas before she's released. But don't expect too much. A small wave of relief washed over Sarah. At least someone would look. The next morning, Sarah arrived for her shift feeling a mix of anticipation and dread. She worried she had overreacted, that Dr. Lee would find nothing, and she'd be seen as a nurse who cried wolf. But then, an urgent message popped up on her pager. Sarah Miller, please report to pathology immediately. Dr. Lee. Her heart quickened. This wasn't a routine call. She hurried down to the pathology department, a knot forming in her stomach. Dr. Lee, the hospital's lead pathologist, was a formidable woman, sharp and no-nonsense. When Sarah entered, Dr. Lee was standing by Mrs. Vance's body, which had been retained for her examination. Dr. Evans was also there, looking distinctly less skeptical than the day before. Nurse Miller, Dr. Lee said, her voice serious, thank you for your keen observation. Sarah felt a surge of adrenaline. What did you find, Doctor? Dr. Lee pointed to Mrs. Vance's lower back. These scratches, Nurse Miller, are more than superficial. Under closer examination, and with a microscope, we found trace amounts of a fibrous material embedded in the deeper layers of the epidermis here. She then moved to the inner forearm. And here, similar findings. The material is consistent with rough cotton fibers, not typical hospital linen. Dr. Evans cleared his throat. We've also just received a preliminary toxicology report. It's not conclusive yet, but there are elevated levels of a certain chemical compound in her system, an industrial solvent. Very unusual for an elderly patient. Sarah felt a chill run down her spine. The thrilling part wasn't a sudden dramatic event, but the slow, creeping realization of something deeply wrong. Mrs. Vance hadn't died from just pneumonia. Dr. Lee continued, the scratches, combined with this chemical finding, suggest a more complex situation. The fibers could indicate she was restrained or struggled against something made of coarse fabric, perhaps a binding, or was dragged across a rough surface. And the solvent, that's a serious concern. We've contacted her nursing home again, Dr. Evans added, his voice grim. They're being less cooperative now. And the family has been re-interviewed. There were some inconsistencies in their statements regarding a recent incident at the home, something about a minor fall that wasn't fully investigated. The natural causes narrative had shattered. Sarah's small, seemingly insignificant observation had opened a door to a much darker truth. The scratches, initially dismissed, were now critical pieces of evidence. They suggested not just neglect, but potentially abuse or an accidental poisoning that had gone unreported. The police were called in shortly after. Mrs. Vance's body was officially placed under investigation. Sarah provided her initial notes and the photographs she had taken. She spent hours giving a detailed account of what she had seen and how she had felt compelled to report it. The following weeks were a whirlwind. The nursing home was thoroughly investigated. It turned out Mrs. Vance, in a moment of confusion and agitation, had indeed tried to leave her room, perhaps triggering the restraint that caused the scratches, and had accidentally